So as you look going forward, what do you see the main focus being, and how do you see the focus playing out? Because we've seen a big change. I mean, we had a lot of money when we first started it.
Yeah.
That was the goal, was to get meaningful use in place and get this technology in place. Now it's shifting. So I don't know, what do you see the kind of the future and the direction?
The focus got started at a time when, as you say, the ARRA bill had passed the HITECH Act, which was part of it. It was a responsibility to put together an entire infrastructure to spend $2 billion to catalyze the marketplace, to work with CMS to put together the Meaningful Use Program, the certification program, a lot of building work and a lot of focus on the electronic health record and on the healthcare setting, and that is an important lever. People may not remember, but at the time we thought that this might be one of the most important ways, if not the only way, we had to really advance care delivery reform. And so we were thinking a lot about how we would get to ground with the tools. Over the course of time, as we've reached this tipping point in adoption of electronic health records, and there's this digitization of the care experience for so many Americans, we've gotten to a place where now everybody's demanding, where is the data? I want it to flow back, not just within my own organization, but as I move across the care continuum, how can we be more inclusive beyond meaningful use providers to let in the long-term post-acute care providers, the behavioral health providers, other important care spaces, but also other health data. And as consumers, and all of us are consumers, as clinicians, as we know how other sectors function, we're impatient. We want to know that health picture is available. The technology piece is so much of the time the part where we believe we have a clear pathway ahead, though honestly I believe we do have work to do in that space. The culture, people, process part, the part that David Blumenthal talked a lot about, is still important and a high priority. So as we go forward, we're thinking we've got a great foundation that everybody built. We need to build on top of that so that we're creating this way to the future of a more internet-like experience for healthcare information, of one where we can do more nuanced privacy data movement, where we can see that health is more than healthcare, and that we're using health IT that's more than electronic health records, while building on the foundation that we have. And just one last point, which I think is worth mentioning. You know, the Office of National Coordinator has been around for a decade or more. It's over 11 years now. And in the earlier years, when we didn't have the grant monies and the Meaningful Use Program, we used levers, state partnerships, the VA, the DoD, other ways that were part of moving forward and advancing health IT. We've really looked back to that history as the Office of National Coordinator to make sure that we, as a federal government, are aligned and sending clear signals to the private sector so that we're better partners, so that when they're interfacing with the Office of Personnel Management for employee health stuff, or TRICARE or the VA, that they have some clarity about what we're all expecting and how we're going to interface as people are trying to move in and out of our systems.
Okay, so there's a proven history on how to use those levers.